Okay, well, I'm going to dive in. And again, good morning, everyone. Welcome, bienvenidos. For those of you who would like to continue in English, please stay put.
Las personas que desean escuchar la versión en español, por favor, elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. Gracias.
Thank you, Dr. O'Shaughnessy. And again, welcome. And good morning to all of our live attendees today. We're thrilled you're here to engage in this exciting webinar entitled At Work in an Integrated Care Setting, a Day in the Life of Behavioral Health Providers. I'm Julie Chronister. I'm one of the hosts of our webinar today. My pronouns are she, her. I'm a white cisgender female, my mid-50s, with light brown shoulder length hair. I have gray glasses on. I'm wearing a black sweater and my background is blurry. I'm a faculty member in the Department of Counseling and the Clinical Mental Health Counseling Program here at San Francisco State. I'm also the project investigator on this project. I am working alongside my project co-investigators, Dr. Molly Streer, who is a faculty and coordinator of our school counseling program, and Dr. Tiffany O'Shaughnessy, who is a faculty and coordinator of our marriage and family therapy program. I would also like to thank our graduate assistant, Chinui Igwe, who's working hard to stay on top of our technical issues, chat boxes, et cetera, today. I'd like to acknowledge that SF State's campuses in San Francisco sit on the ancestral homeland of the Ramaytush Ohlone. We further acknowledge that we work on the ancestral lands and waters of many other indigenous peoples and nations in our field work in the Bay Area and around the world. We are committed to ensuring this webinar is accessible to our attendees. Closed captioning is available through our Zoom function. If at any time your access needs are not met or become not met during the webinar, please send a chat directly to the host or co-host. Access is always a work in progress, so we appreciate your comments, feedback, and support. This is our second webinar of the year, sponsored by our Equity and Justice-focused Integrated Behavioral Health Counselor Training Project, which is fully funded by the Department of Health and Human Services, Health Resources and Services Administration as part of an award totaling $1.9 million. A couple of things before we begin. If you are one of our HRSA stipend recipients, i.e., a student in our graduate program, or you are interested in receiving continuing education units for your attendance today, please pay close attention to the announcements in the chat for sign-in and evaluation links. As a reminder, this is a live recorded Zoom webinar. Therefore, the audience is not visible and the audience cannot turn on their audio or video. The chat function is available for comments, sharing resources, supportive emojis, etc. However, to ask the presenter a specific question, please post your question in the Q&A function. The Q&A will occur during the last 10 to 15 minutes of the webinar. So please post your questions in the Q&A as they emerge, and the presenter will answer questions at the end of the webinar. If we cannot get to all questions, please contact the presenters or us directly. And the presenter's information is posted in the chat as well. It is with great pleasure that I introduce today's presenter, who also presented our first webinar. So this is a series, and we are grateful for this series. I'd like to present Kristen Potterbush and Julie Schultz. Kristen Potterbush is a senior program manager in the Clinical and Quality Partners team. She joined Primary Care Development Corporation in 2019 to direct and grow a federal program for building the capacity of HIV/AIDS service providers, and currently works across initiatives to advance and promote integrated care, provide content expertise to federally funded high-impact prevention projects, and support other work aligned with the promotion of health equity. Kristen's career is centered around understanding that health begins before the healthcare setting. Julie Schultz is a senior director on the Clinical and Quality Partners team. She joined the Primary Care Development Corporation in 2022 to support initiatives focused on primary care integration. Prior to primary care development corporation, Julie held several executive leadership roles with community, provider, and payer organizations, developing and implementing strategy focused on value, delivery system reform, and primary care transformation. Julie has dedicated her career to working on innovative solutions with healthcare and communities that are person and family centered with a focus on equity. Thank you for joining us today, Kristen and Julie, and please take it away.
Thank you so much for that kind introduction, Julie. So as said, Julie and I are both part of Primary Care Development Corporation. We're a nonprofit headquartered in New York City, but our colleagues and we work across the country to center health equity and advance positive health outcomes. And we're really proud to be a part of this work. So I am an individual who has brown shoulder length hair, gold rimmed brown glasses. I am white and I am in front of a blurry background. I'm wearing a green tweed suit jacket and an orange sweater, or a rust colored sweater rather. So today, our key objectives that we hope you come away with are to understand the composition of integrated care teams, to recognize the role of the behavioral health provider within a no wrong door approach to care, and that you'll be able to identify how you, a behavioral health provider, can help leverage interdisciplinary teams to mitigate your own burnout. So to do this, we're going to sort of hit across 3 different points. We're going to discuss the types of teams and members most commonly found within integrated care environments. We're going to go through sort of being part of a no wrong door and what a no wrong door approach is. And then we're going to talk about how integration benefits you. And as part of that section, Julie's actually going to run through a mock day in the life of an integrated care behavioral health provider. So integrated care teams. First, I'm going to ask for a little bit of audience participation here. If you could imagine your ideal team composition within a healthcare setting, what would that composition be? So if you, and please put that in the chat, not the Q&A box, just the running chat. If you had to think of who you want to work beside you. Do you want a nutritionist that you're working with? Do you want someone who is a peer who has lived experience? Do you want someone who is a particular expert who's in leadership? Do you want someone who's a dentist? Who would be on your ideal team? What would that team composition look like? I'm going to give a minute or 2 for folks to respond. And thanks for engaging in this Imagine If activity. Excellent. We've got social worker who has experience. Yes. An acupuncturist. I love that. I love that. Who else? Who else do you want on your dream team here? Medical, social worker, peer, occupational therapist, nutritional, love it. Social worker, psychologist, medical, geriatric MD, psychiatrist. Yes. Love that. Geriatric MDs and geriatric NPs, so critical here. Medical doctors, OT, PT, behavioral health providers, nurses, psychologists. Perfect. Julie, thanks for adding it typed out in the chat. Developmental pediatrician. Okay, perfect. Pharmacist. Yes, yes. Promotoras with Mayan and Indigenous community. Wonderful, wonderful, Jasmine. RN, licensed vocational nurses. Yes. Okay. So hold these dream teams in your mind. We may even revisit them later in the presentation. So my next question, as you're holding these beautiful team compositions, your dream teams in your hearts and your minds here, what would your ideal, I put that twice, what would your ideal collaboration style be with this team? How often would you speak with your dream teams? What would you check in about? How would you relay information with these colleagues? Would you want to speak perfect. Pashana's got it. So do you want to do daily? Do you want to do, okay, we've got 15 minutes. Do you want to do one hour a week, but 5-minute huddles? Do you want to check in just via EMR notes? Okay, we've got daily huddle, and there's no wrong answers here. I want to say it's just about, as you reflect on your dream team, how do you want to best collaborate with them? Okay, perfect. Thank you. Okay. Collaboration and check-ins. Yes, definitely. Love that. Weekly and as needed. Short check-ins, weekly, longer in person. Easy to use. Yes, easy to use EMR. I like that caveat, Jen. And schedule a meeting for complex cases throughout the day. Love that. Doesn't sit with me in the behavioral health pot. I love that. Okay. This is beautiful. So the reason we're asking these questions is because we kind of have to hold both when we're in an integrated care environment. Hold that we have our ideals and we have the reality of how every integrated care environment is going to be slightly different. And that's because the needs of a client, the clients that you serve, are going to largely or should largely determine the types of services and providers and collaboration styles that an organization has. And each organization is going to have a different type of composition, but you are empowered as a behavioral health provider to hold in your head that dream team and seek out to either be part of organizations that have that style, that type of composition that you said in the chat, and also to advocate, if you're at an organization, for bringing folks in to be a part of your team that you know would be ideal for being able to do your work and provide the services that you want to provide. You're also in a position to advocate for the collaboration style that works for you. And there's yes, the easy button on the EHR. There's often a lot of opportunities for changes and for shifting within integrated care environments. It's often not a one and done. So sometimes, I know I said here, each organization has different collaboration styles, but sometimes it can change throughout the year. And you might be able to say, wait a second, with this particular team, we need to have 15-minute huddles daily, or a longer case consult once a week and short check-ins. If you know what's going to work for you, you're able to bring that knowledge as a champion into an integrated care system and really make it your own. We do want to make sure we leave you with information around what is most common. Although, again, as integrated care evolves and matures, there is more and more space for making these ideals that you put in the chat a reality because of individuals like yourselves coming in as experts into the system. Right now, some common combinations, though, that you may see of these teams would be just having primary care providers or specialists plus behavioral health. And that could be anyone from an LCSW to psychologists. We also often see behavioral health plus a case manager plus an individual with lived experience, such as a peer. And we often see primary care, specialty, case manager, and behavioral health. And these are sort of the more common combinations that we see. But again, these are blossoming and growing, and a lot of your ideals are becoming a reality. So we also see some common collaboration styles, and folks really put this in the chat, which is fantastic. We see varying lengths of morning huddles. We see case consults for high-need clients, and we often see some kind of a weekly hour or case review plus a daily EMR note review. And so it's usually some combination of these or one or the other of these. But again, when you come into an integrated care system, you have the opportunity to invite change and invite shifts and say, hey, if this isn't working, if we're not relaying the communication we need to each other, you can suggest that the organization consider shifting or do a PDSA or perform sort of a mini test cycle of a different style of communication, and that can be really valuable. So, in speaking about the roles that some folks find within sort of those little, I don't know, what do I want to call them, like little mathematical equations of combinations here. First and foremost, we have clients. And, this was something that my colleague Julie and I talked a little bit about when creating this presentation, that clients are really a part of and should always be centered when we're talking about integrated care, and understanding what clients need is a part of determining what are the other roles that should be on your team. So primary care has a key role to play, as does behavioral health. Also, more and more, we're seeing oral health being part of the conversations along with case managers. We're also seeing as peers are able to be billable in some states, and more coming on that bandwagon. We're able to see organizations have more than just one individual who's a peer, which is phenomenal in terms of resources and access. We're also seeing nutrition becoming a little bit more of a default of something that organizations are working towards. And billing is actually a really critical part of an integrated care system, because billing can be a little bit different or complex within a system where you have multiple different kinds of care, and sometimes providers collaborating in ways that, you know, billing or state systems aren't necessarily set up intuitively to allow an organization to sustain the kind of collaboration and move that forward. Also, we can never overlook folks who are frontline, who are front desk individuals who are helping to understand, helping individuals to navigate, building rapport, making the space safe for clients to feel comfortable scheduling and being engaged in multifaceted services. And also, administration has a really important role to play as advocates, as folks who are often hiring, as folks who are championing. There are folks who I've seen in leadership roles at integrated care systems who took advocacy all the way to, you know, the state house and state legislatures to ensure that their organizations could provide the care that their clients, again, top here, that their clients needed. So speaking of providing the care that clients need, we can't talk about that without talking a little bit about No Wrong Door. And this may be something that a lot of you on the call are familiar with. So I'm not going to spend too long on sort of this intro section to it. We just want to acknowledge, you know, what does No Wrong Door mean? And essentially it means that a client can access care from any point at any juncture in your system. So for instance, to speak a little bit about, you know, the role of a front desk, you know, staff member within an integrated care system, if someone's checking in and they're checking in for a primary care appointment, and they mention that they've been really stressed and they can't believe they made it on time and things have been really hard for them, and, you know, someone in, you know, maybe a good friend of theirs just passed away, or they're really struggling with something, that individual at the front desk can take a moment and say, hey, you know, we actually have some folks, you know, that are pretty helpful to talk to if you're going through something. Do you want to learn a little bit more about that? Or you can talk to your primary care provider about it, or I can just book you an appointment to chat with someone that, you know, I think is really friendly and a lot of folks, you know, enjoy talking to. And that's what No Wrong Door can look like, just listening to what someone's expressing and linking them into care, into that access from the front desk to any other point in the system. So how do you operationalize No Wrong Door? And there is complexity here because it does require, you know, to use a metaphor, when ducks are sort of gliding along the water and you think they're, you know, just sailing smoothly across a serene lake. And then if you were to see their feet are frantically paddling. Sometimes there's a little bit of that, maybe not frantic paddling, but a little bit of extra coordination that goes on below the duck to make sure that No Wrong Door can be facilitated. So an organization that's integrated and has a No Wrong Door approach, which many and all really should, you're going to be designing a system. And so you would be potentially part of a system where there are workflows that are facilitating no barrier access to any services. So if someone is in an appointment with you, so if you have a 15-year-old in an appointment with you and they mention that they haven't actually gone in, they haven't had a primary care provider visit, since they were 10 years old, you might recognize and say, hey, this is an opportunity where, maybe you've just been going and seeing someone to get your school form signed. But if you're interested, we can talk to you or, go through sort of the steps to, maybe have you start seeing one of our providers here so that you can have, a regular primary care provider that you're seeing. And that's what goes on behind the scenes there would be you as a behavioral health provider potentially doing some scheduling, potentially reaching out to a primary care provider, or even doing a warm handoff between that client and a primary care provider. You might write a note in your EMR, in your easy button EMR, as I think we're calling it today. And you might also connect with someone at the front desk and see if, you can facilitate the scheduling process. You may also connect with billing to see what are the ways to circumvent any potential insurance barriers to getting that client in to see a primary care provider. So there is a little bit of work that goes on, again, below the surface of the water, below the duck. But what the client experiences is they just told you in something, you recognize that they might have a need, and you're going to rise to meet that need. I can't talk about No Wrong Door without talking about where we're going and where I hope that we continue to go as a field, which is, I don't know, in this, I'm calling it the next door frontier, if you will. But, if we're saying no wrong door, what eventually we want to get to is open door, which is once you're through a door that you can sort of seamlessly move between various services and care provision and new care initiation, while collaboration and communication between care providers is always there so that a client doesn't have barriers to care. So if, for instance, that client that we were just using as an example who was in your office, they saw a primary care provider one time and then they came back to you, and then maybe they saw a nutritionist 2 times. If they ever went back to the primary care provider would, because of consent forms that they signed and with consent, may already be up to speed on, maybe what they needed and what they were working on. Even if they hadn't been in to see that primary care provider for a year, they would be able to check in on some core areas to maybe create, if needed, some shared treatment goals. And open door doesn't preclude no wrong door. In fact, it's sort of what can happen once the doors are once someone has gone through a no wrong door. But we really want to get to a point where folks aren't going through a door and then they're stuck and they have to come out the door and then they have to go across the hall and then into another door. We want to get to a point where once the door is open into care, an individual can move seamlessly. Next slide. Okay, so we want to also acknowledge that behavioral health providers are truly the key to some of these doors that we're discussing. And some of the key areas that I have seen and that we've seen in our careers are behavioral health providers are truly key for initiating new services for clients. And again, this will be visited a little bit in the example day in the life that Julie goes through. But even in my example from earlier, clients are going to share information with you, a trusted professional, in a way that they may not share with other folks that they encounter as part of integrated care systems. It's what you bring. It's one of the privileges you have as someone who's in your field. So you serve a very unique and key role in being able to hear if a client says they get dizzy after they stand up, or if a client says that they are really struggling with an aspect of their health, or if someone discloses food insecurity. You are in a position to be able to take that trust and invite that individual, that client, into a conversation of, is there action that client would like to have taken around what they just disclosed? Are they interested in being connected with a nutritionist or a case manager who can link them to food resources? You are so key in making sure that comprehensive health services are even possible. Also, you are really key in identifying what an individual's current or future care goals are. You are the person who will know what an individual might be working towards. If an individual is, trying to maybe shift aspects of their life, or has a sports goal they're working towards, or has a housing goal they're working towards, or something about their personal life, maybe they're looking forward to a birthday party, you're going to be somewhat of the expert within the integrated care team, perhaps you and the peer and or the case manager, on what is really going to motivate this client and what can you position the care that you're providing for this client around. You also are going to understand that future orientation for adolescents or anyone can never, ever be assumed. And an integrated care system does rely on the idea that someone is interested in receiving multiple points of care for positive health outcomes for a life trajectory. And I know in my experience, and maybe in yours as well, it's important to acknowledge that sometimes a success is just getting to tomorrow. And you're going to be the expert on how to balance supporting your client in the right way for their needs. You're also going to serve as an educator to other providers on supportive client interactions. There will be opportunities for you to educate your colleagues in primary care, in billing, front desk individuals, administration on how to best communicate information and ideas and to elicit sort of the kind of potential change or behavior change modifications that might be really important for the physiological health or other health aspects for the clients that you're collaboratively providing care to. And never doubt that you really are that educator for your colleagues and that it is absolutely appropriate to rely on your expertise working with people who are your clients to also provide that same professional guidance and expertise for how your colleagues can also interact in positive ways with clients. And finally, it can be exhausting to engage in a multifaceted service environment. And sometimes clients who are in an integrated care system can experience multi-service saturation, which is an easy way, which is a complicated way of saying they might just have a lot of appointments and that can get a little tiring. So you're likely going to be, especially in certain circumstances, you're going to be the person who has your finger to the ground around, is this client getting a little bit too wrapped around with care? Are they likely to start falling out of care or no call, no showing because they have engaged in every single service and it's time to prioritize and take a step back? And how do you have those conversations? Well, by being the advocate and champion you are and being the expert on that client's current and future care goals. So with that, we're going to talk a little bit about how integration truly can be leveraged to support you, the behavioral health provider, because there's some really interesting information that is coming out around how integration and supportive team environments can help mitigate burnout. And I'm going to turn it over to Julie to walk us through a sort of a day in the life here to kick us off.
Thank you, Kristen. Hello, everyone. I'm Julie Shills. My pronouns are she and her. I am a cisgender woman in my late 50s. My hair is shoulder length brown and graying. I am wearing a gray sweater with a gray t-shirt underneath that has a flowered gray pattern on it. My background is blurry. I'm so excited to be here today. Before I jump into a day in the life, I just want everyone to step back and think about the conversation we've had thus far. You've thought about what your dream team is, who would be on the team, how you would want to engage with them. You've thought a little bit about no wrong door and heard some concepts around that. And really, Kristen shared a lot about why your role is so important and the strengths that you bring to an integrated care setting and why that is so critical. So keep all of those in mind as I go through a bit of a day in a life. So the first thing that happens is you arrive at the clinic, hopefully get some coffee or tea or whatever your beverage of choice may be, and review the schedule for the day. You may have done that the day before, but sometimes there are changes before you walk in the door. Your integrated care delivery setting has a morning huddle. So everyone gets together who's on the team and discusses the shared clients. Within that, the pharmacist shares that one of the adolescents was really struggling with adherence on the medications. So they changed the medication to a long-acting injectable. So what that helped to do is really work on adherence, didn't have to take a pill every day. This just surfaces an opportunity that when you're having these conversations of the type of interactions that can happen when you're in an integrated care setting. The next thing that happens, you move into sessions with clients. Working in that EHR, you notice that there's progress towards treatment goals, suggestions on modifications. When you're with a client, the client mentions that they have unprotected sex. You consider sharing basic information about PrEP and conduct a warm handoff to a physician for potential additional conversations. I'm going to turn this back over to Kristen, who has some experience in this space, to share why it's so important.
Thank you so much for that, Julie. So a little bit about what this can look like specifically, also because many of you on the call today work with adolescents. When we're talking about PrEP or pre-exposure prophylaxis, we're talking about an opportunity to provide a medication to an individual who may be engaging in behaviors that increase their risk for contracting HIV. Behavioral health providers are often in a position where you're going to hear information that allows you to note that an individual could benefit from PrEP. Within an integrated care system, we have a wonderful opportunity where if a client discloses a need for a prescription medication, you will hear the information that indicates that they could benefit from something. They may not specifically ask you for PrEP, just like an individual may not specifically know why when they stand up, they're very dizzy, but they may express information that indicates to you from your knowledge that they could benefit from something like PrEP. You are within an integrated care system having the opportunity to play to your strengths and to the providers around you's strengths. And Julie will continue speaking through that in just a moment. But for this example, what this could look like is talking to that client and letting them know that there's a medication that they could take that would, provide them with protection and an opportunity to feel more safe and more comfortable, and also support their health long-term. So you can provide that handoff to a primary care provider. You can be there for the conversation, and you don't have to be an expert on PrEP yourself, just like you don't have to be an expert on diabetes or hypertension or thyroid conditions. You can simply let the client know even that some stuff that they've told you today sounds like it might, they may benefit from connecting with a primary care provider. There's someone really great who works here and you'd love to set them up with an appointment. And also, is it okay if you share a little bit about what that client told you today with that doctor so that, you both could collaborate and make sure that that client gets their needs met. So that's just an example on the PrEP side, on sort of the HIV prevention side of things, around how integrated care can really show up and allow you to play to your strengths, allow a client to have their needs met, even when they may not know that there is a way to meet their needs, and also play to the strengths of your primary care colleagues.
Thank you, Kristen. So as you're going through your day, the client also shares that they're juggling just a lot of different appointments. And this surfaces for you, gosh, I wonder if we can do something about that. Can we look at how the appointments are stacked? Can we bring the team together and consider, is there a way to organize these appointments in a way that it's providing less challenges for the clients? So again, with consent, that's a really key part of an integrated care system. You invite a peer to come in at the end of the session who can provide some of that support and really look at the appointments and all of the schedules and really be able to address that part of the needs that the client has. And as you can see, sometimes the needs are related to another clinician. Sometimes the needs are related to another team member who provides more administrative support. So it really brings in that sense of that the care team being a broad set of individuals who all have strengths and all have talents that they can bring into the setting. So now you have the opportunity to take a quick lunch, do some documentation, but you have a team member who and a clinic who's calling for your support. So the oral health team calls and says, you know, we have a client who is here. They're having a panic attack while they're getting their cavity filled. Will you please come and support us? So that's an opportunity for you in your role with your skill sets to be able to support your other team members, entering into the dental clinic, being able to talk with the client, find out what their needs are, what's happening to them, in which the setting and the service and what's going on is causing them to have a panic attack. And perhaps scheduling additional services. Maybe the service needs to be stopped for now, or maybe through the conversation, it allows the client to be able to continue with the procedure as it was scheduled. So it does put you a little bit behind in your notes, and that can be part of a day in a life as well in an integrated clinic, because you never know what's going to come up in that day. More client sessions, you're talking to a new client and you realize that the family is struggling with food insecurity. This is an opportunity, again, with client consent to check in on the resources that are available within the clinic and see if nutrition is free, to be able to set the client, the family up with some of the services that are available through the clinic, grocery store gift cards, other resources, snacks, to lessen that food insecurity, and perhaps set up the client, the family with other additional services that are available through the clinic setting. In those moments and in those in-between moments that you have, there's always that opportunity to either catch up on documentation or look in the notes related to any notes that may have been sent to you related to other clients, or get caught up on clients that you may be seeing in the next day. You happen to have someone who didn't show up for an appointment. So the list is available for you, and one of your newer colleagues comes and needs a little help. They want to talk to you about and access your skill sets and your support in talking through how to respond to some of the questions related to intake screening. And linking those to social determinants of health. So you have an opportunity to do a little bit of teach back with a peer as well. Those are some of the things that can happen throughout a day. So it's not always just strictly related to what the client's needs are. Your colleagues may need some support throughout the day as well. So it's just an interesting way to think about how you can bring your skills. So at the end of the day, everyone comes back for a huddle, and sometimes not all the team members are there. They may be still meeting with clients, or they've gone home for the day. If you have promotoras or community health workers, a lot of times they're out in the community. So that's something to think about in your perfect state practice. How might you engage with those team members who are out in the community and create connections with them and share information? But in this end of day team huddle, it's a great place to share that you did have a no-show and you're wondering about that client. So the front desk staff can set up time to outreach and do follow up the next day, just to make sure that everything's okay with the client and that nothing has happened that really is impactful and caused that no-show. You mentioned your new client and that it needs to get rescheduled and prioritizing the meeting with the nutritionist and almost going through everything that you've done for the day and really getting things rescheduled and set up. It's also a time to set up follow-up plans with your colleagues, like the nutritionist, to make sure that things are going okay with that family who had that area of food insecurity, because that can produce anxiety and have an impact related to what you may be working with for the client. Again, it's that time to perhaps, either get caught up in your notes or look at the notes before seeing your next set of clients. And before leaving the clinic, you may have a note from a colleague and peer who met with the client, and they're recommending that they kind of like to stay connected and continue to collaborate so that there isn't, a closed door for the client in terms of the care being dropped, and that the number of visits that they're having and making sure that everything is going smoothly with the plan that's been established. When you collaborate with your peers in this way, one of the things that will happen for all of you is that the setting you're in will all be at different places as well. This was perhaps more of a perfect state day in a life. Some clinics may be just starting their integration journey, and that's a way to bring your skill sets to the table. Some will be at a place where they've been doing this work for quite some time, but maybe they're adding new resources like a nutritionist, like oral health, perhaps vision care, perhaps promotoras. So as different resources or new peers or colleagues are being brought into the system, it's an opportunity to have those conversations about how communication can happen and the strengths you bring to the team and how you would like to work with them. So just take a moment and reflect. Integration is a give and take. You will be needing some support from your colleagues at times. You will be providing support for your colleagues at times. And at all times, thinking about the clients you're working with and what are their needs and how can you step into that role and that open door in terms of providing integration. That reciprocity among each other, learning and sharing, creating that trust and interdependence among each other. It really creates a virtual cycle, especially in those days where the clinic setting is moving in an incredibly fast pace. Kristen mentioned earlier the idea of reducing burnout. When you know you have a team of people, even if the day is going fast, if you know you can trust them and depend on them, it certainly makes for a setting in which you're feeling at least that while the day is going fast, I know I can bring my best self. So perhaps in the chat, and we'll be moving to some questions here pretty quickly, but in the chat, love to hear from everybody about what felt good about some of the day of the life and what you've heard today. What you think, gosh, I don't know, if I like that part of a day in the life, and I might want to advocate for something a little bit different. Making things easier for the client and wrapping up at the end of the day. So not a lot of times we've heard about those morning huddles, but doing a end of day huddle as well. That's great. Teach back and huddles. And when you think about some of the things that you're sharing, things like teach back, in a lot of ways, these are skills that you all use when you're working for clients. They can be things you bring into your work every day, and even in many cases, as you're engaging with your peers. Expanding services on site. Collaboration, self-efficacy. Really having everything go towards the client. Love that. Keep putting things in as you think about them. We'll move to the next slide and kind of close ourselves out, but have time for questions. And with this, Kristen, I'll turn it back over to you, but I'll monitor the chat. And if people keep putting things in about what they like about the idea of integration and where the opportunities are.
Well, thank you so much, Julie. And thank you everyone so much for your engagement in the chat. And I was laughing earlier at Daphne's comment that she was only slightly behind on notes. I cannot promise that in an integrated care system, you will only be slightly behind. We can only hope. I'm not promising that if you're part of an integrated care system, you will not be behind on notes. You may not be behind on notes, but that is no guarantee. So just sort of to close out what we've talked about today, really want to acknowledge sort of these three key points and tie them back to our objectives. We want to acknowledge that team composition and collaboration is so key. And as Julie walked us through the day in the life, you could really see those examples of the members of your team having that nutritionist, having that peer that you called in support of your client was key, and your collaboration and support for that oral health team and for your colleague who needed a little support and a little upskilling around asking those social determinants of health screening questions. Making sure that you have the right team members to collaborate to meet the client's needs in front of you. Also acknowledging how key behavioral health is within an integrated care system. Again, going back to what Julie walked us through the day in your life, there were multiple instances where you as a behavioral health provider really were part of the glue that held the day together for your colleagues. And also you were able to rely on your colleagues as your own kind of glue. And that's part of opening these doors to access and ensuring that clients have all of their needs met that your system can deliver on. And then finally, how integration works for you. And again, hearkening back to our presentation and to what Julie was saying on the previous slide. It's about that strengths-based approach and knowing that you have a safety net of other providers who you don't have to be an expert on PrEP. You don't have to be the person who knows everything about nutrition and resources in your area. You're able to tag in and tag out with colleagues. That allows you to focus on bringing your best self, as Julie said, bringing your strengths to the table for your clients, which at the end of the day, we have found does reduce the kind of incidents and mode switching and stretching that can really eventually lead to some burnout. And we know that behavioral health providers really do and can experience struggles in early, mid, and late career with the amount of different tasks and items that you're juggling, all in service of your chosen profession. And so integrated care systems offer an opportunity to really mitigate that burnout through having those strengths-based approaches. You'll always have someone to call on, someone to tag in, someone to support you just as you're ready to support them. And that takes us to sort of our last slide here. So we'll be opening up for questions now. If you have any further questions that we can't answer, this is how to get in touch with us. I think if those of you on the line were here with us last time, we have some more resources on some services, on our website. These are all free. These are some webinars we've done in the past on various topics within integration. So I think now I'd be happy to answer questions that have come in, and I'll just catch up on any of the chats that I've missed.
Yeah, I just want to say very briefly, thank you so much for this webinar. I have to say I love the door and the duck metaphors. They're very powerful. And also, I really also appreciate how you all not only talked about the importance of behavioral health support and intervention, but support around navigating the process of care as a key role of behavioral health providers. But I'm going to stop because we have a couple questions, and I'm not sure if you can see the Q&A, but I will read it out loud. The first question from Victor is, no wrong door is outstanding, but we often, I think, have fiscal and staffing limitations. This frustrates so many of us. Waiting lists for essential services, for example. What can we do to overcome this?
I do not have an easy answer for you, Victor. So the first thing I will do is validate. You are right. You are right to be frustrated. There are absolutely fiscal and staffing limitations, and waiting lists are sometimes absolutely months and years long, to the point where you may wonder, is it even worth referring a client to this service if the client may not even live here by the time that this waiting list, they've moved up on this waiting list. So I guess a couple things. The first thing is, I want to say that you personally are not expected to overcome this. You personally, Victor, are part of a field and part of work that together can shift and change some of the systems that we're in. And that's really, I think, the place that we are at. As an individual, your work can be being honest and transparent with clients around linking them into services and helping them to have the kind of expectations that are unfortunately what are reasonable now, which is this may be an 8-month waiting list. And also searching internally at your organization and being that champion, that key, that advocate. Is there something, a grant your organization can apply for that would enable you to hire an additional person that could be an in-house, housing services navigator? Is there, an opportunity for your clinic to start bringing in folks who are maybe new in the field and need supervision so that you can staff up immediately with potentially, I know someone said, case managers with experience. Maybe you need to just staff up with case managers and provide that supportive guidance and sort of work together with folks to mentor into the field. But you, Victor, are part of this field together. And I want to celebrate that you want to shift it and change it. And I want to also say that we are here with you in this. You don't have to do it alone. Julie, what are your thoughts on this?
I think that's true. And it's probably also around potentially prioritizing some of the areas, depending on the service that you're talking about. Is there another option? Or is there something else in the community? Just a bit of brainstorming is our usual go-to. Can there be something else we can consider? Because there are wait lists. So it's sort of necessity is the mother of invention from that perspective, but agree with everything Kristen had said. And I am seeing the next question in the chat, but Julie, I don't know if you want to go ahead and read it and then I can respond.
Sure. This is from Amy. What are some things related to, quote, staying in their lane that a behavioral health provider would need to keep in mind when discussing potentially helpful medications with a client?
I would say that this is something that is probably falls into the category of all healthcare is local or all clinics have a bit of their own style and culture. So it's really something to discuss with other team members. It could be a little bit of what is your comfort level, and it could be different related to different medications. If it's a newer medication, maybe it's, you're talking about something, only so far, but once there's a comfort level, then you talk farther. So there's not one answer for this. I think it really is about having conversations, establishing a structure, talking with the other peers and colleagues in the team, and about different medications and how it might look in the clinic. I wasn't sure if staying in the lane was something your framing you were bringing to it, or maybe if that was language you were hearing from others. It was interesting language that I think is worth exploring as a scope of practice. Got it. Yeah. I do think with scope of practice, it is just good to have those conversations in the clinic and really have those agreements among colleagues about what conversations will happen. I think Kristen did a nice job of sort of talking about the possibilities related to PrEP, and when you kind of do that handoff, and the conversations about medications were really at, a certain level. So.
Yeah, completely 100% agree with what Julie is speaking to about that importance of the conversation. And if you're working in an environment where you're working with a PCP who doesn't have a lot of experience with behavioral health medications, that's a conversation that you and that individual are going to have and come to, as Julie was speaking to, sort of understanding of what you both can bring to the process. And I think that that's key, because we're talking about strengths-based here, and we're talking about strengths-based within these systems. And I think what Julie's really highlighting is sometimes you might have a strength in an area that someone else, be they a primary care provider in your integrated care system, or be they, someone who is trying to understand how to talk through screening tools, you might hold the expertise. And so being open to sharing when you have that expertise to bring, and standing firm in when you're coming from a position of that strength, and also having those conversations to understand how that may be able to be supportive of you and your fellow colleagues. Scope of practice is something, again, exactly as Julie said, it's going to vary place to place. It's going to vary team to team. And so I guess just being, or not, I know that being open to having those conversations that really are the groundwork of healthy, safe work environments and collaboration are going to be really key, so that it's not so much staying in one's lane or one scope of practice. It's understanding what skills everyone brings to the table and what everybody is going to be able to bring their best selves around.
Yeah, and I really appreciate that question as a counselor educator. I just want to add, our students take a class in psychopharmacology,
Yeah.
and it's superficial to some extent, but I think particularly in the integrated care setting, you need to have a bit of knowledge on things that you may not be steeply learning in your curriculum. And so, to be flexible and fluid around that. But I suspect that not just counseling, but also social work disciplines, and gain some experience around psychopharmacology, which in fact you could have more than the primary care. I appreciate that. I think scope of practice is always a fuzzy line when it comes to what it looks like functionally in these settings versus, pedagogical training.
Absolutely.
Well, it's 11:59. I was going to ask a question, but I think I have to hold off. We're so grateful for your presentation. Lots of thank yous, and this has really been helpful really appreciated the day in the life. I mean, just going through it, I think was really helpful for people. And thinking about what does it look like to walk through this. And so thank you very much to you all. And I want to remind our audience that we do have another webinar on November 10th, Student Voices and Advocacy for Student Mental Health. So don't forget to register for that. And again, thank you, Kristen and Julie, so much for these two wonderful webinars. And we hope to have you back. And thank you, audience, for joining.
Thank you all so much for having us, and thank you for the work that you're doing.
Yes, thank you.